All right. Hello, everyone, and welcome to another episode of Let's Talk About Health. I'm your host, Madeline Mant, and today I'm really delighted to introduce our special guest, Julia Clemens, who's here to tell us all about her experience as a physician assistant. So welcome, Julia.
Hi, Maddie. Thanks for having me.
Of course. I've been so excited to have you on here because your job is interesting and maybe a little mysterious. So can you tell me, what is a physician assistant?
Yeah, so a physician assistant is sort of best conceptualized as a physician extender. So what that means is we're trained healthcare professionals. We do a 2-year program that usually follows an undergraduate degree and mirrors very similarly to medical school kind of curriculum. But where it differs from medical school is that when we finish, we don't do a residency. We go right into the workforce, and we're always supervised by physicians. So when you start your career as a physician assistant, that relationship will look very kind of close together. You'll be assessing patients in whatever kind of field you work in, and the physician will be kind of monitoring those assessments, helping you build your skill set. And then slowly, kind of as you grow and you progress, you become more and more independent. But the whole idea kind of behind a PA is that there are lots of things that we deal with in healthcare that you really don't need someone with, 8 to 10 years of specialty training to deal with. And so PAs are trained as kind of general healthcare providers. They graduate much faster than physicians do. And then they work as a team with physicians to kind of bring more care to more patients.
Right. I love this analogy of the extender. I'm just imagining like an Inspector Gadget type thing, which lets you know exactly how old I am. So this sounds super interesting, but also I would love to get in some of the nitty gritty. So can you tell me a little bit about what are your special skills and relationships? Like, what does your day-to-day look like?
Yeah, for sure. So in my role, I work in the emergency department at the hospital for sick children, which means I do entirely pediatric emergency medicine. So day 0 of life up until age 18, essentially. And so that means assessing patients and treating patients who come through the doors in the emergency department. As a PA, I would say I can handle and sort of deal with probably about 90% of the cases that come through the ED. And then, of course, the physicians are the ones who deal with, like the multi-system trauma patients or the really kind of sick, really unwell patients. And then I'm left to kind of be seeing the patients in the department who maybe don't need that really, really high level of care, but have a broken bone or have a urinary infection or a cold. So if you're a family member of a patient being seen at Sick Kids and you missed the part at the beginning of the visit when I introduced myself, I probably would look very much like the doctor to you during the visit. You may not realize that I wasn't, in fact, the doctor. And then specifically in PA roles, PAs tend to do a lot of procedural skills because these things take a long time. They keep the physician from being able to move on to other cases. So our PA team in the emergency department at Sick Kids does all of the cast application. So anyone who gets a broken bone, we apply all the splints. We do quite a bit of the kind of laceration repairs and the suturing, as well as kind of, assessing patients, getting the history, doing the physical exam, and deciding on a treatment plan.
That's incredible. And so when you talk about you're working in emergency department, where else might I find a physician assistant if I was just out in the world potentially encountering them?
Yeah, absolutely. So basically, if it's an area of medicine, you'll find somewhere that there is a PA helping in that specialty. The vast majority, I would say, of PAs in Ontario, at least, work either in emergency medicine, in primary care. So like when you go into your family doctor's office, you may actually see a physician assistant rather than your family doctor. And then in surgical subspecialties. So that means both kind of managing patients who are admitted after surgery and also assisting surgeons in the operating room. So those are the common ones where PAs end up working, but there are PAs in every single subspecialty. So if you are interested in medicine and you love dermatology, but maybe you think medical school or becoming a physician isn't quite right for you, there's a PA doing that.
So you're everywhere.
We're everywhere.
I'm like, they're everywhere. No, I love that. It sounds like a really, really fascinating way to expand some interest in various specialties and to be able to apply some skills right away. It's really interesting to hear that you don't do residency, but that you're right away in those clinics and in those healthcare spaces. Mm-hmm. Now, my next question is bringing us back to some of the anthropology aspects and to talk a little bit about some vocabulary. And so in your job, how are you using words and thinking about words like health and illness and wellness and sickness? Like, what role do those words play for you?
Yeah, absolutely. That's a big question, right? Because these words can mean very different things depending on what you're trying to achieve within our healthcare system. When I think of the word health, the first thing that comes to mind based on my experiences is access. So I think a lot about how PAs kind of fill a role for creating larger health access for people and how important health access is to kind of wellness and overall health. So for example, we know that there are less providers in northern communities in Ontario. And so the health outcomes are worse simply because people don't have access. And so that's a big kind of piece of what I think about is, we all know what it feels like to be sick and to need to seek care. But there's a much larger kind of side of the piece of health that is preventative medicine, right? We kind of use a little phrase in medicine that is an ounce of prevention is worth a pound of cure, right? So way easier to keep a person from starting smoking than it is to treat a lung cancer. And so these kind of concepts are all very high level, but I think about health and, where we can create health access, we can create those conversations that lead to prevention of illness rather than trying to sort of chase your tail in terms of treating disease.
Absolutely. Well, thank you so much for that reflection. That was really fascinating. And so I'm sure everybody listening to this video now is already looking up physician assistant programs and planning on doing this. So can you tell us a little bit maybe of your journey and how might somebody actually go about becoming a PA?
Yeah, absolutely. So currently in Ontario, there's 2 physician assistant programs. There's one at McMaster and there's one at the University of Toronto. Both of the programs actually are ones that you can apply to after your second year of an undergraduate degree, but the vast majority of the candidates sort of complete an undergraduate degree before they're accepted into the program. And then we have kind of people from all different paths that end up becoming PAs. So sometimes they have pre-existing healthcare experience, they're a nurse, they're a registered massage therapist, and sometimes they do what I did, which is that I was a direct academic route. So I did an undergraduate degree in life sciences and biology, and then I applied to the program in my 4th year and did it kind of as it's a second undergraduate degree, similar to medical programs. You would get a kind of second BHSC or Bachelor of Health Sciences. But you don't actually need to be a science major to apply to the McMaster program. It has a sort of loose model of, we'll teach you what you need to know. So I also had classmates who had, degrees in like bachelors of arts, bachelors of fine arts. And so it's not just one specific type of candidate or specific type of student fits the mold. And then, like I mentioned, it's a 2-year program. So you do 1 year sort of all group-based learning in class, learning all your anatomy, physiology, pathologies of different illnesses, body systems, all that stuff. And then you do 1 year of placements where you are going kind of every 4 to 6 weeks to different patient settings. So emergency medicine, surgery, psychiatry, family medicine, and then some elective time, which I did most of in pediatrics. And then you graduate and then the real learning begins.
I love that. There's no residency, but then you actually start learning after, for you, 6 years of just continuous college and university.
Yeah, exactly.
Well, thank you, Julia, so much for sharing your time and expertise with us. This has been an absolutely fascinating conversation. And I want to thank also our audience for tuning in and just say thank you again. And we'll see you next time on Let's Talk About Health.